At the beginning, Edmonton Seniors Coordinating Council really facilitated the conversation in Edmonton among the various community-based organizations about what this initiative was going to look like, what social isolation looks like. Each of the partners had a specific series of objectives and different communities that they wanted to serve, to reach out to. The role of the backbone was really to keep them together, to allow them to share their ideas, share their challenges, and ensure that the work that they were doing aligned with the impact plan that had been put forward at the beginning, and really start to dig into the challenges faced by isolated and low-resource seniors in Edmonton. The work that they were doing supported each other. They created some really interesting and long-lasting relationships.
One of the positive things that the PEGASIS collaboration allowed for us was to offer senior-specific programming and to reach out and to find them. This was really EMCN's first foray into very senior-specific programming, other than offering language classes that were senior-specific. So this meant that we were able to go out and find people who weren't leaving their home. And by nature of the fact that they were afraid to leave their home for a variety of reasons, or their family members were afraid to let them leave their home, collaborating with Drive Happiness allowed us to ensure their safety getting to and from language classes, which meant that they were willing to try and step outside of their comfort zone, and that meant that family members were willing to let their parents come to the classes.
We see it in all the individuals we serve. If we can just get them just the one time into a center like EMCN, it could be a game changer for them, because all the services are there and we have the ability just to get them there.
There was lots of unintended benefits, I think. The drivers really enjoyed. They were receiving something even while they were giving something to the immigrant seniors. And I know the immigrant seniors who used the services were really oftentimes enjoyed feeling like they were making Canadian friends, or feeling like people were accepting of them the way that they were. And they also were coming from English class or going to English class, so they really had a lot of fun practicing their English with the drivers. So it was like a homework club.
We've worked with GEF for a really long time, but what PEGASIS really allowed us to do was to work again with the social work staff. And so that when we did referrals and perhaps there were issues with folks, then you actually could work with social work staff who understood some of those challenges, rather than a housing manager who really wants to put the best mix of people into her building, not considering the issues an individual might have, and that there would be supports, as there are with the social work staff at GEF, to be able to work on those issues following. So I think that had been a real benefit in many tough cases that we refer.
GEF now had a social worker who was talking with Sage's social worker, and so we were in a much better position. You weren't doing a social worker to a housing person, someone who's trying to fill a building, type of conversation anymore, but it was, okay, how can we make things work for this senior? And we were talking the same language. And I think that is a door that has opened up a lot in terms of our work. I really do believe that this partnership for us has been a tremendous win, because from our organizational perspective, for those seniors with hoarding behavior, it's really been a very big win.
EMCN being in the PCN space meant that there was a lot of cross-pollination and learning from both organizations' standpoints. So the PCN staff, not just the PEGASIS connected staff, were able to learn a lot about the experiences of seniors and the barriers that seniors experience to accessing healthcare services. And the seniors themselves were in a health environment and were made aware that it didn't have to be so scary or foreign or complicated as they might have thought it would be.
I think it was a really great example of how cohabitating can lead to that natural relationship building and opportunity finding, where it doesn't necessarily need to all be in place at the beginning. It can really develop as things arise and as we get to know each other's capacities and our clients a little bit more. Through the conversations with these newcomer seniors, I really got to know where their hesitancies were in some of their fears about joining a telephone program or even using the telephone.
Eliza is the kind of leader who's willing to work together, and right away we're talking about how can we share resources. And then one day she came to me, she said she wanted to do a volunteer appreciation for her volunteer drivers. But she's struggling with a few things. One is the space. Second is the kitchen. Then she doesn't have the staff who's able to organizing all the events because she only have 4 staff. Well, all of those happen to be the things that I have. So of course I offer the space, and then I involve my marketing and program, like event planning staff, to support her, and then I bring my kitchen staff on board to support her.
We have all these wonderful places that are there for them, and they don't actually know that. And so the goal around the appreciation event with WESAC was to get more people in the center to see what they have to offer, and in hopes that they would start going there to, for one, have more of their needs met and reduce their social isolation.
Relationships all across the board are the one thing that lasts the longest after you've collaborated, and they will outlast even if resources dry up. However, to continue a long-term collective impact collaboration, those resources and reasons have to be really strong. The relationships can't carry it on their own.
The critical next steps really are broadening the conversation to include as many networks and stakeholders as possible, to really go beyond the 6 core partners, to reach out to stakeholders from multiple sectors, including governments, including the medical community, including housing, including businesses.
Instead of each doing our own thing, let's make more effective use of the resources we have, and it's by doing that and the different partners and stakeholders around a table all do play a role, then we can begin to make more of a difference, more of an impact. So collectively we make an impact. We can put all sorts of resources into programs and services, but until we start really as a community working at the systemic barrier level and trying to reduce those barriers, no program is going to address some of those things like financial insecurity and lack of assisted transportation funding and operational dollars for these community-based organizations, because we know that the work that they do it's great, but it needs more resources and support in being able to offer those non-medical services in a way that helps a senior be able to age well in the community.